Professor Aybek works as a director at TOBB University, Faculty of Cardiovascular Surgery. He applies a digital checkup to his patients with a highly innovative method.
We know that the heart is an organ that weighs around 400 grams and pumps arterial blood to the body 100,000 times a day. However, in recent years, research has shown that the heart is much more complex structure than has been previously understood. The heart is continuously communicating with the whole body. It receives and transfers information from the brain, lungs, digestive system, hormones, muscles, and other organs all of the time. Some areas of the brain, especially the medulla, autonomic nervous system, amygdala, fear center, and thalamus, subconscious, have a strong connection with the heart and are constantly sending and receiving signals. The heart doesn't have direct communication with the brain cortex, thinking center. We cannot increase or decrease our heartbeats consciously. However, the aforementioned centers of the brain are able to do this. The heart corresponds with the music of the body like a pair of ice skaters dancing. However, sometimes it takes over and becomes the director as it makes the music more alive. When we are breathing, running, under stress, sleeping, eating, or reading, it harmonizes with the body and fulfilling the needs of the body. Our heart generates electricity all the time. This energy, power, and electrical current create an electromagnetic field. This field can be detected from the distance of 4 meters, and it is 40 times more powerful than the brain. For this reason, we sometimes feel close to certain people and we think that our energy harmonizes with theirs. We feel like this because of magnetic fields are matching with those people. How can we detect all of this? We analyze the signals that are coming from the heart with a high-resolution device, and we can detect millisecond differences of the heartbeat. In recent years, scientists have been conducting studies to find the reasoning behind this. When we analyze approximately 100,000 heartbeats and the heart rate variability in a day, it gives us a lot of information about an individual's general state of health. To enable us to do this, we use an analysis algorithm developed by our Australian partner Dr. Alfred Loninger called Autonom Health. We call this project Energy Analysis. Thanks to this analysis, we can reveal an individual's daily stress level, deep sleep cycles and regeneration, organ and muscle circulation, biological age, nutritional deficiency, and other informations. This analysis shows a 20-year-old user 24-hour heart rate follow-up graphic. 0.25 level shows deep sleep cycles and regeneration. 0.10 level shows sympathetic activation area, which gives information about the user's reaction to daily stress and the strength of this her sympathetic activation. 0.05 level at the bottom shows organ and muscle circulation. For this user, we can say that the general blood circulation level is very good. However, when we look at the vitality analysis of the 42-year-old mother who has 3 children and working night shifts with chronic stress, we can see that the situation is very different. 0.25 deep sleep cycle and regeneration level are significantly low. 0.10 level correlating to the sympathetic activity isn't sufficient. 0.05 level, which relates to organ and muscle circulation, is very low. This user doesn't have any specific disease. However, If she doesn't change her lifestyle and continues like this, she may suffer from heart disease or cancer. This user's biological age is calculated as 64. In another example, there is a 50-year-old company owner with 340 workers who has tried to commit suicide and was hospitalized as a result. His checkup results were fine. As it is clear, this user's vitality is low and he has burnout syndrome. His biological age is 84. Scientific vitality analysis with patch ECG can be used in many different sectors. It can be used for drivers, pilots, judges, prosecutors, or doctors. In this example, you can see the 24-hour vitality analysis of a driver who drinks 2 glasses of wine for dinner every evening. This man dozes off after these meals, and although his night sleep is deep and good quality, he is sleepy on the 3-hour drive because of the alcohol he has taken the day before. Heart rate variability analysis can also be used for professional athletes. This graphic shows a 38-year-old male athlete who goes to the fitness center in the evenings. His analysis shows that the exercise that he has been doing is actually very harmful to him. It can be seen that this affects his night sleep. As shown, the development in the field of telemedicine helps preventative health medicine to develop as well. Vitality analysis with patch ECG clearly shows an individual's overall health and mental state. Thanks to friend Bernd Orsasek, a Swiss doctor, this analysis turns our heart signals into a striking visual. When we turn these numbers that we occur from the heart into the musical notes, we can hear the sounds of our unique hearts.